Namaskar and welcome to the Ayurveda Mantra Show. In this weekly show, we talk about benefits of Ayurveda and how it can cure or prevent any disease through various Panchkarma treatments. Santigram Kerala Ayurveda Wellness Centers USA offers genuine Kerala-specific Ayurvedic therapies to cure any disease or prevent any sickness. Dr. Ambika Nair, one of the founders of these centers, has over 30 years of experience in treating individuals through Ayurvedic treatments and has cured many individuals. Dr. Ambika Nair is with us in this show. Dr. Nair, welcome to the show.
Hi Sanjeev. Hello TV viewers. Hope you all are really enjoying my topics, whatever I am discussing, and following whatever I am saying. And really you will be benefited, and I am really happy to be here again with the show.
And we thank you for being here. Many viewers are watching our show and they are appreciating the information that you've been giving out on Ayurveda, the importance of Ayurveda. And that's why one of our viewers have contacted us and she specifically requested that we talk about sleep apnea. As I believe sleep apnea is a growing problem in the South Asian community. So can you tell us what is sleep apnea?
Okay, it is an obstructive sleep, you understand? See, there are, sleep means you don't get a proper sleep, but you are still sleeping.
So is it like a sleep disorder?
It is a disorder, but there are, it's a big subject actually.
Okay.
See, due to the obstruction, and there are so many types of that, and first one can be due to the obstruction. Second one will be with the central, that is with the nervous system and any diseases from the brain or anything like that.
Mature.
Okay, and even myasthenia gravis. There are so many other things. Okay, the third one, it will be mixed. That's one of the things.
Okay. What actually causes sleep apnea?
Okay, that's a very good question actually. What causes itself is if you are taking a lot of alcohol, if you are overweight, chronic allergies where you are not at all cured. In this, because you get all the allergies and not only seasonal allergies, this fellow's allergy will never be cured. Okay. And the mucosal thickening will be there, deviated nasal septum will be there, nasal polyps will be there. There are so many issues like that. And there can be some other, not only with some bone growth can be there, some medical other issues are there with that. Okay. This is due to the obstruction and even in the nasal passage also. When you cannot breathe, when you don't get much oxygen itself, you are irritated. Okay, then your behavior itself changes.
Okay.
First of all, how you identify these people is that wherever they sit, they will sleep in the daytime.
Acha.
Yeah.
Okay.
See, for them, driving is crazy.
And how many times will they fall asleep during a daytime?
Oh, daytime, wherever you put them, even while working, while talking, they just jabkiam lena shuru
Oh, that's no good.
That's not at all good actually, because it affects that they cannot concentrate because of the fogginess. They won't be able to remember. Actually, we get a lot of cases like that. Like that fellow was around 49-year-old, and his daughter was getting engaged at that time, and he was going to lose the job. They have given some days for him because he cannot remember anything.
Oh my God.
Yeah, so that was very interesting case, I should say, because treated a lot of cases, but certain times in life you don't know what to do, helplessness, So at that time, yeah.
Are there different types of sleep apnea?
Yeah, that's what this is about, the obstruction I'm telling.
Okay.
Then the nervous system, like if you had a stroke.
Correct.
Okay. Then it is not in your control. Okay. So then you will be doing snoring a lot. People snore a lot. Actually, that is the way we diagnose them.
But snoring, in my opinion, I think snoring is pretty common problem. So does it really mean that whoever snores has a sleep apnea?
No,
problem?
it's not a must that, because see, for anti-allergic, if you take a lot of like antihistamines, okay, then you will get, because you are not in your control, then you will snore a lot. Alcohol, if you drink a lot of alcohol, definitely you will snore. Because your tummy also, because you put on a lot of weight. Depression, fear, they don't like to go outside.
So it's a combination of any
It is
one of those.
Yeah, this is an outcome actually, because it cannot be in one cause. Yeah. There are so many, what else, liver diseases, even ascites.
In your many years of practice, what have you noticed when it comes to sleep apnea? How young age patients, I mean, the youngest age of patients that have come to you?
Youngest was like a 3-year-old.
Okay, so now here's the question. For a 3-year-old baby, right, how could sleep apnea happen?
Because the mother came and told me, that is a recent issue actually. But the mother came, 3 year, 1 month, okay. So the mother came and told her, he will be always tossing on the bed. He'll be snoring because of the adenoids, okay, and the tonsils. So that was very interesting. He cannot focus. Whatever you say, whatever he wants to do, only he will do. Because he cannot even hear, because that it affects the auditory nerve also, because the hearing also get impaired in certain cases, because it is compressing.
Okay.
That is the issue.
Okay.
So, then we did, anyway, that was, then very restless, he was very panic, very angry, opening the mouth and sleeping, always, dry mouth.
So that 3-year-old baby was, let's say, born with some kind of difficulties.
Yeah, he had
that
little
caused
bit of,
sleep apnea.
little issue was there actually.
Right. So then if we just put the baby aside, then maybe teenage.
Teenage is very common.
Teenage is very common.
Very common.
Because some of the factors that you mentioned, they really start affecting in teenagers' lives.
Teenagers also because of the allergies and all.
Correct.
Then the stress level, they don't sleep in proper time, bad habits of taking food. Whatever you need not to eat, they will be continuously eating that, eating a lot of cold food. Okay. See, and we have like a differentiation also, whether it is with the kapha, whether it is with the pitta, or it is vata also. But mostly it is with the kapha, they overeat a lot.
Okay.
Okay, with the depression.
Correct.
Then they don't, just after eating again they feel hungry, because this is because they know that they have an issue. So some people come and tell, otherwise their parents or wife or husband, they come and tell.
Okay.
Yeah.
Anyway, viewers, we are watching the Ayurveda Mantra Show and we're talking about sleep apnea in this episode. We're going to take a short break, and when we come back, we're going to talk about how Ayurveda can cure or prevent sleep apnea. Hello TV Asia viewers, and welcome back to the Ayurveda Mantra Show. Just before break, we started to talk about sleep apnea, and then we'll continue to talk about it. Dr. Nair, who is with us, Dr. Ambika Nair, बताइए कि how Ayurveda can help and cure sleep apnea.
Okay. See, first of all, when they come, we assess them by the pulse analysis. What is the real cause? Then we ask the patient.
That is important to find out.
That is really,
since you mentioned various
because you have to
factors.
treat for the cause of it.
Correct,
Yeah,
exactly.
not like, see, then we'll ask them, see, some people will tell that because they sweat a lot during the sleep, because this is like carbon dioxide is more, they are not getting much oxygen.
Correct.
You understand? And they cannot focus, they feel always heavy and foggy.
Wow.
Yeah, that is one of the things, and their, like eating habits, eating wrong food in the wrong time, taking so much of ice. Because in Ayurveda, we always say that after the sunset, you should not take anything cold, because that is, increasing tamas. Like increasing kapha in you.
But in today's day and age that we are living in, right, it's practically impossible, seriously.
But you can try to help yourself,
No,
at
I know
least
that.
reducing
That is
it.
correct, yes.
Yeah.
Yeah.
It's not nowhere it is written that you should only eat only cold food.
No.
Yeah,
That's
that's
I'm
there.
not saying
Yeah.
that, but it's really difficult to, especially in the hot days, right? How can you not have?
But it's not, like whether you take, see, Like if you take a little, it's not a must that tepid water.
Correct.
Or the room temperature water also, it will help you.
Okay.
Yeah.
So in this case, what you're saying is a proper diet is also important.
Diet is more important because these people will always have, like a very depressed mood. Yeah, that is, they get so anger, they cannot control themselves. That is another thing. Yeah.
Okay,
Yeah.
all right. And once you diagnose, let's say one cause, and
Yeah.
then you begin a treatment,
Yeah.
what kind of treatment is that? What kind
Because
of Ayurveda
normally,
treatment?
like preparing for Panchakarma, some people can just go with the Panchakarma and according to the situation. So we otherwise preparing.
Okay.
Yeah. So some people need like a Snehapanam first, then we give them, like a Virachanam. It can be through the Nasyam also, and even with the vomiting, like emesis, that is.
Okay.
Yeah.
And this sleep apnea,
Yeah.
Is it fair to say maybe a male has more sleep apnea problem than a female, or vice versa? What can you say?
It's actually more with the male.
More with the male.
Yeah,
Okay.
even with the blood pressure also it comes,
Okay, okay, okay. Now, through this Ayurveda treatment, is it completely cured at the end of the treatment, or it's a repetitive? That means you have to
No.
go every year, every
No,
2
no,
years
no.
for it?
No, it's not like repetitive. See, we tell them what to eat, how to go with that, and we tell them, see, Panchakarma cannot be done every day, you understand, no?
No, absolutely not.
So
yes.
that is a torture, this is a very good question, I should say, because people come and ask me, you want me to do Panchakarma every day? I don't know. If once we do you suggest us to come every year or every 6 months? It all depends upon the cases. We never advise anybody like that. But certain cases, very chronic cases only comes to us. So some cases we tell them, just come for a follow-up. Sometimes, very bad cases, we tell them to come after 6 months, maybe like 1 week or so. And maybe like a very chronic arthritis and all, like after 1 year they come. So if they do it, they will be much benefited. And not that it is not like a sin to come and do once Panchakarma. It is not only for, like making you better, it is for avoiding also the diseases. When you know that the road is blocked, I don't think that you will accept that block and go. So it is always like a servicing of your body.
Okay.
Yeah.
So once you diagnose and then once you begin a treatment, at the end
Yeah.
of the treatment, let's say patient is cured.
Yeah.
But if patient does not follow diet or does not make any changes in their lifestyle routine, right, does sleep apnea come back?
No, wait. First of all, during the consultation itself, the viewers knows that what I say. How much you are going to help me?
Correct.
I will be helping you more. So don't think that because the doctor will cure you or doctor can cure you. You have to help yourself.
Correct.
I am here to help you, that's all. Because nobody can change anybody unless they want to change.
Very true.
Yeah.
Yes.
So we tell them. So first itself I will tell the diet. Okay, especially for the sleep apnea, for all this mucus, because that is increased kapha. Okay. So we tell them not to eat any milk and milk products. Okay.
Okay.
Because that is actually, especially the cheese. In this country they eat a lot of cheese.
Correct.
Okay, cheese itself does not get digested. That's why, because it all accumulates in the air passages and it block it. It is like even past sinusitis, you understand? Then you become little allergic to certain cold, very hot, or all those things. Then we tell them not to go with that. Banana, which are the foods creates or cause kapha, we tell them to be away from that. Okay.
Now, you mentioned cheese. Yes, it's fact that in this country, people eat more cheese and food which gives more carbohydrate food and whatnot. South Asian community versus non-South Asian community, whites and others, right? They eat cheese every day. They live on this kind of food every day. Do they have more sleep apnea problem than South Asian community problem?
Sleep apnea is seen actually mostly in Americans.
Really?
They overeat a lot, and their tummy, you can see how
Correct.
you know,
Yeah.
like because of the overweight actually.
Okay.
Because the diaphragm also, you know, because it obstructs everything.
Mm.
Then how much the lung can work for that?
So the food that they eat every day, or they've
Yeah,
been
it
eating it
makes
ever since
overeating.
they were born, right?
Overeating,
Okay. So
Yeah.
it also causes, sleep apnea causes
Yes.
to them also.
definitely. It is not only for Indians or Asians.
Correct.
It is with anybody.
Okay.
Yeah.
Okay. And when they come to you, because
Yeah.
I know at Santigram Kerala Ayurveda wellness centers, right? It's not only Indians, not only South Asians, but Americans, whites
Every
and
walks of life.
they all come. Do they follow your treatments also, or suggestions and everything?
Sincerely, I'm sorry to say, they follow better than our people.
Oh, okay.
Strictly they follow and they get the benefit. They say, even like after few months, like even years, they will come, they tell that because I cannot forget you. What I was eating, it was all wrong. Now what I eat, you see, doctor, I don't have any issues now.
Interesting.
And it's very interesting actually.
Alrighty. Okay, viewers, we are watching the Ayurveda Mantra show, and we're going to take a short break. After the break, when we come back, we're going to talk about why and how Ayurveda is important than any other medicines in treating sleep apnea. Hello TVHA viewers, and welcome back to the Ayurveda Mantra show. In this weekly show, we actually talk about benefits of Ayurveda. Dr. Ambika Nair of Santigram Kerala Ayurveda Wellness Centers in USA every week gives out importance of Ayurveda and gives us a mantra of Ayurveda also. Before we go to Ayurveda mantra, let's just talk about sleep apnea. A little while ago, we talked about sleep apnea and how Ayurveda can cure sleep apnea. Now, let's talk about other medicines. When patient come to you, is it fair to say that they've been to their doctors and they have tried allopathy or other medicine and it didn't work and they come to you?
They go to so many doctors.
Correct.
Ayurveda, they think that it takes a lot of time. Oh, it's very slow acting, no? They will ask me. We tell that I never felt it. You can see how it will change you. You understand? Okay. Then, when we talk about that, then they really follow also and they get the benefits. And Nasyam is done for them. See, in children also with these things, because they will be taking all antihistamines and all, and nebulization, even asthma, you understand? No? So, all these things, like steroids, so all the complications are also there. Then they come, then they will tell, okay, we were taking for 15 years, 18 years, 25 years, like that. Because elderly people, they will be taking 30 years, 35 years. So we tell them, okay, now at least you came, at least if you can follow what I am telling, and if you can really, you are interested, I will be able to help you more. And in the children also, because of the sleep apnea, so many developmental problems will come.
Okay.
Yeah, in their studies and their hyperactivity.
Correct.
Sometimes they don't, they are just in the way what they want to do.
So at the end of Ayurveda treatment, and after after going through so many years of different medicine, right? When they come to you, and I guess, do they tell you that this is what they really needed in order to have sleep apnea cured, and after that they don't need to go to see doctor?
See, sleep apnea, it takes time to be cured, because it always say that because how many years they are suffering. So not in 2-3 weeks I'll be able to cure somebody.
Absolutely, yes.
Okay, so that is because they know that how the severity has come down, and with the exercise, with the reduction, 100% they will reduce their weight. Okay, any doctor, everybody will tell them reduce the weight, then only he can do it. Okay, then you have to treat for the cause. So Nasyam is done, and there are some other Panchakarma treatments what we give, So, and I told you about Snehapanam and all, and Uddhavardhanam, because according to the need it is. If what do you tell, like a Shashika, very heavy people.
Right.
Okay, so we will do Uddavardhana for them so that their tummy will come down, their adipose tissues. Because when you overeat your adipose tissues, it doesn't give anything for them.
Correct.
Only they snore, that's all.
If somebody doesn't have an overeating problem and someone who's not overweight or something like that, and a person has been maintaining his or her body very well and in a good shape, have you noticed sleep apnea in those kind of
Maybe
individuals?
because of the obstruction.
Correct.
Okay. This is very interesting. See, every pitta also has little kapha in them. You understand? So you ask them, oh, this is always seasonal, doctor. They will tell.
Oh,
but you know, like they will be always. It's not like every time pouring out, but obstruction. Okay. Even some accidents also they cause a lot of obstruction because any you know like a nose is deviated or something like that. Any polyps like that or anything like that, it will also cause.
All right, and that's what I think we are here to tell our viewers, that in case if you have any one of these symptoms, or in case if you know someone in your family has any one of these symptoms, then before you go to your primary doctor, at least think about Ayurveda. Ayurveda has its own benefits, and through Ayurveda treatments it can definitely be cured, and in case if it's an early stage, it can definitely be prevented, and that's what Ayurveda treatment is all about. Santigram Kerala Ayurvedic Wellness Centers USA can really take care of this problem through different Panchakarma treatments, and that's what we have discussed in this episode. And we thank you for watching Ayurveda Mantra, and you can send us any questions that you may have. info@tvasiausa.com is our email ID. And just like one of our viewers requested us to talk about sleep apnea, I hope you're watching it, and I hope the information which Dr. Ambika Nair has given, hope that helps you. And in case by any chance you are a sleep apnea patient, then you can contact Santigram Kerala Ayurvedic Wellness Centers USA. Dr. Nair, in the end, I'd like to request you to give Ayurveda mantra to our TV Asia viewers. Ayurveda mantra of the day.
Okay, especially for any chronic sinusitis or any little sleep apnea. See, constipation is also one of the important things, you understand? So you can take Triphala 1 teaspoon with a half glass of water at night, and you should take like a half teaspoon of turmeric powder with a half teaspoon of like honey with a little bit of warm water in the morning, because these things will help a lot. And try not to take anything cold, especially early morning. That itself is beneficial for you. Try to avoid as much as you can, like milk products and yogurt. In this country, you all eat a lot of yogurt early morning. That is a very bad practice. You should not take yogurt early morning. In the daytime, you can always take it, and even after sunset, you should not take it. Please follow whatever I say. It is only for your benefit. Thank you.
Very nice, Dr. Nair. Thank you so much for giving out these valuable suggestions every week in this show, Ayurveda Mantra on TV Asia. Next week, when we come back at the same place, same time, we're going to talk about something also very important, and hope you'll be watching the show. Thank you so much. Take care and stay well.
Thank you so much.